As what you can see in here, we have provided an illustration of the structures of the lower respiratory tract with its labels. Lungs are essential organs of the respiratory system responsible for the exchange of oxygen and carbon dioxide between the air we breathe and our bloodstream. Lungs are two spongy organs located in the thorax, consist of elastic tissue filled with an interlacing network of tubes and sacs that carries air and blood vessels that carries blood. Each lung is divided into lobes, the right lung into three lobes, and left lung into two. Left lung has an indentation called cardiac depression or notch for placement of the heart. At the end of each bronchiole or the alveoli, lungs contains about 300 million alveoli sacs, which are the air cells where the exchange of oxygen and carbon dioxide takes place with the capillaries. The base of the lungs rests on the diaphragm, a muscular wall separating the thorax from the abdominal cavity. It is involved in respiration, drawing downward in the chest during inhalation and pushing upward during exhalation. Tidal volume refers to the amount of air inhaled or exhaled during normal breathing. About 500 ml total lung capacity is 3.6 up to 9.4 liters in an average male. Pathogens, white cells, and immune proteins present during an infection may cause the air sacs to become inflamed and filled with fluid. This is the characteristic of pneumonia. If both lungs are involved, it is termed as double pneumonia. If someone is unconscious, it is possible to aspirate stomach contents into the lungs, causing aspiration pneumonia.
Now let's proceed to the physiology of respiratory system. Pulmonary ventilation or breathing. Movement of gases through a pressure gradient, high to low. When atmospheric pressure is greater than lung pressure, air flows in, which results to inspiration. When lung pressure is greater than atmospheric pressure, air flows out, which results to expiration. Pressure gradients are established by changes in thoracic cavity. Increased size in thorax results to a decrease in pressure. Air moves in. Decrease in thorax results to an increase in pressure. Air moves out. Referring to these given images, when we breathe in, our chest, ribs, and diaphragm expands, then our lower diaphragm contracts. When we breathe out, our chest and lungs contracts, then our diaphragm relaxes. Now, when we say inspiration, it is a contraction of diaphragm and intercostal muscle. Expiration, on the other hand, is the relaxation of diaphragm and intercostal muscle. Now, let's proceed to the volume of air exchange. Tidal volume is an amount of air exhaled normally after typical inspiration. In a normal sense, it takes about 500 ml. Expiratory reserve volume is an additional amount of air forcibly expired after tidal expiration. It also takes about 8,000 or 1,000 ml. Inspiratory reserve volume, or deep breath, is an amount of air that can be forcibly inhaled over and above normal. Residual volume is an amount of air that stays trapped in the alveoli. It takes about 1.2 liters. Eupnea is a normal quiet breathing which takes about 12 to 17 beats per minute. Next is hyperpnea. Hyperpnea, increase in breathing to meet increased demand by body for oxygen. Hyperventilation is an increase of pulmonary ventilation in exchange of the need for oxygen. Hypoventilation is a decrease in pulmonary ventilation. And lastly, apnea, a temporary cessation of breathing at the end of normal expiration.
Heimlich maneuver. Heimlich maneuver have also four techniques for the unconscious victim. First, catch victim if they begin to fall. Place on floor face up. Second, straddle hips. Third, place one hand on top of other on the victim's abdomen, above navel and below xiphoid process. And the last one, forceful upward thrust with heel of hand, several times if necessary. Heimlich maneuver have also four techniques for the unconscious victim. First, catch victim if they begin to fall. Place on floor face up. Second, straddle hips. Third, place one hand on top of other on the victim's abdomen, above navel and below xiphoid process. And the last one, forceful upward thrust with heel of hand, several times if necessary.
Next, we have emphysema. It is a type of lung disease that causes breathlessness. It is usually caused by cigarette smoking. There is no cure, but the condition can be managed by using medications and adjustment to lifestyle. Symptoms could include shortness of breath, cough, rapid breathing, sputum production, and wheezing. Your healthcare provider can diagnose emphysema through managing and breathing tests. Treatment includes quitting smoking and taking medications. We have hay fever, also called allergic rhinitis, causes cold-like symptoms. These may include a runny nose, itchy eyes, congestion, sneezing, and sinus pressure. But unlike a cold, hay fever isn't caused by a virus. But it is an allergic reaction to environmental allergens such as pollens, dust mite, molds, and animal dander. And avoiding allergic triggers and taking appropriate treatments are the best ways to reduce the frequency of hay fever symptoms. And here are the list of remedies for hay fever. We have sniffing salt water, antihistamine and sprays, mast cell stabilizing sprays and eye drops, antihistamine tablets, anti-asthma drugs, steroid tablets, and immunotherapy. Lastly is we have pneumonia. Pneumonia is an infection that affects one or both lungs. It causes the air sacs or alveoli of the lungs to fill up with fluid or pus. Bacteria, viruses, or fungi may cause pneumonia. It is mostly spread when people infected cough, sneeze, or talk, sending respiratory droplets into the air. These droplets can then be inhaled by close contacts. Less often, you can get pneumonia from touching an object or surface that has the germ on it and then touching your nose or mouth. And pneumonia can be serious, so it is important to get treatment quickly. The main treatment for bacterial pneumonia is antibiotics. You should also rest and drink plenty of water. If you are diagnosed with bacterial pneumonia, your doctor should give you antibiotic to take within 4 hours.